Strokes occur when sudden blood and oxygen flow to a part of the brain arises. There are three main types of strokes, which doctors treat in different ways, which we will address in this video. The stroke is the fifth leading cause of death in the United States. About 87% of strokes are ischemic strokes, which occur when something prevents adequate blood flow through the brain artery. Stroke kills brain tissue. Thus it can be fatal. In fact, according to the Centers for Disease Control and Prevention (CDC), strokes account for about 1 in every 19 deaths worldwide. So we'll talk about different types of strokes. You will also explore the causes of each type, possible symptoms and some of their treatment options. Types of strokes. 1. Ischemic stroke. What is vertebral stroke? Ischemic stroke is the most common type of stroke. It occurs when blood clots in the blood vessels cause insufficient blood flow to the brain. This can happen when a person has atherosclerosis, for example. A blood clot that travels from one area of the body to the blood vessels in the brain may also cause ischemic stroke. Symptoms. Symptoms of ischemic strokes include sudden numbness in any part of the body, deficit or on one side of the body, weak facial muscles or one side of the face, vision changes, especially in only one eye, feeling dizzy or losing balance, difficulty walking, confusion, sudden severe headache with no known cause. Risk factors. Although anyone can suffer from ischemic stroke, some people have higher risk factors for developing it. Some of the risk factors for ischemic strokes include: the person is female, as the female lives longer and is therefore likely to live long enough to have a stroke. People with vasculitis. People with atherosclerosis, a condition that leads to the accumulation of fatty plaques in the arterial walls. Smokers. Who drink a lot of alcohol. Those who don't exercise a lot. People over 65 years old. People with atrial fibrillation, AFib, a heart condition that causes fast or irregular heartbeat. Each type of stroke and symptoms and causes and treatment of each. Methods of treatment. There is no treatment for ischemic strokes currently. Instead, urgent treatment methods focus on removing a clot and preventing further brain damage. The first step of treatment tends to give the patient a tissue stimulator through a vein in the arm to quickly dissolve the blood clot and improve blood flow to the affected area of the brain. In some cases, it may be necessary to treat or remove the clot with a procedure called thrombectomy. Thrombectomy works best when the surgeon does this within 6 hours of the symptoms of a stroke. However, thrombectomy may improve disease within 24 hours after stroke. To help a person restore body function and deal with stroke pressure, he may need a variety of supportive therapies, which may include speech therapy, exercise or movement therapy, physical therapy, psychotherapy. The doctor may also recommend making certain changes in the patient's lifestyle, such as following a low-fat diet or exercising more, to reduce the risk of another stroke. 2. Transient ischemic attack strokes, TIA, sometimes called delicate stroke, are similar to ischemic stroke in that they temporarily block blood flow to the brain. However, unlike an incidence of ischemic stroke, doctors do not believe TIAs cause permanent brain damage. Symptoms of a transient stroke. Transient strokes of TIAs may cause symptoms similar to ischemic stroke symptoms, including confusion, difficulty walking, weak facial muscles or one side of the face, feeling of tingling or numbness. However, these symptoms tend to be less severe and last only a few minutes. Unlike an ischemic stroke, it is treated on its own, when the clot moves or melts. Risk factors. The risk factors for transient strokes are the same as the risk factors for this ischemic stroke and include being older, being a smoker, doing exercise at a small rate, suffering from cardiovascular diseases, suffering from atrial fibrillation. Transient strokes of TIAs occur before about 15% of vertebral strokes. This means that 15% of people with a TIA transient stroke will suffer from vertebral stroke in the future. Methods of prevention. A person with TIA transient strokes should speak with the doctor about lifestyle changes, medications and other treatment options that can reduce the risk of stroke.